So guys, let's talk about what is fever. So before talking about fever, let's define fever. Fever is defined as an elevation of body temperature above normal circadian variation as a result of change in thermoregulatory center located in anterior hypothalamus. The most accurate part for measuring the core body temperature is rectal, oral, and then axillary. Maximum normal oral temperature at 6 a.m. is 98.6 and at 6 p.m. is 99.6. Normal diurnal variation is 1 degree Fahrenheit. Rectal temperature is 1 degree Fahrenheit more than the oral, and oral temperature is 1 degree Fahrenheit more than axillary. So regulatory center for fever present in our body is preoptic area of anterior hypothalamus, and fever plus yeah, if the pyrogen is present inside our body, that is in blood, uh, that substance is called pyrogen. And if the substance is present if the substance is external substance, the substance is called exogenous pyrogens. So let's see about fever with relative bradycardia. Fever with relative bradycardia, in which condition you can see fever with relative bradycardia? In case of typhoid fever, in case of meningitis, and in case of viral fever, influenza, brucellosis, leptospirosis, drug-induced fever. Fever with exanthema, rash appearing on first day of fever, chickenpox, rash appearing on the fourth day of fever is measles, and rash appearing on the seventh day of fever is typhoid. So the patterns of fevers, it can be continuous, remittent, intermittent, and relapsing. So define continuous fevers. So the continuous fever, the temperature remains elevated above normal without touching the baseline, and the fluctuation does not exist 1 degree, which is seen in case of lower pneumonia, infective endocarditis, enteric fever, UTI, and brucellosis. Remittent temperature fluctuation exists 1 degree but without touching the baseline, which is usually seen in case of abscess. Intermittent temperature touches the baseline in between, which is also defined as temperature is present for some hours in a day and remits to normal for remaining time, which is seen in case of sepsis. Quotidian fever. Quotidian fever is a hectic fever occurring daily. Relapsing fever. Febrile episodes are separated by normal temperature for more than 1 day, which is seen in case of torsion fever, quartan fever, pale abstinent fever, saddle back fever, cyclic neutropenia. So the torsion fever, example of torsion fever occurring alternate days, which is seen in case of Plasmodium vivax, Plasmodium falciparum, and Plasmodium ovale. Quartan fever, which is occurring every 2 days, which is seen in case of Plasmodium malaria. And pale abstinent fever, which is lasting 3 to 10 days, followed by a febrile period of 3 to 10 days, which is seen in case of Hodgkin's. So the saddle back fever, initially fever lasts 2 to 3 days, followed by remission lasting for 2 days, and then fever reappears and continues for 2 to 3 days, which is in case of dengue fever. Cyclic neutropenia, fever occurs every 21 days. So there are another patterns of fever, which is also called drug fever, which is which is defined as prolonged fever, relative bradycardia, and hypotension. Fever persists for 2 to 3 days even after the drug is withdrawn, and the name of the drugs are penicillins, procainamide, propyl thiouracil, sulfonamides, anticonvulsants. Low-grade fever, which is seen in case of tuberculosis, in which there is evening rise of temperatures, and that does not exceed more than 37, usually not exceed more than 37.8 degrees Celsius. So let's talk about pathogenesis of fevers. When our tissues become infected with bacteria, viruses, during that time our body immune system reacts to that exogenous pyrogens. The body immune systems, that is white blood cells, also called leukocytes. They respond to infection and release a protein. That protein is called interleukin 1, and this production of interleukin 1 leads to the production of prostaglandins. This prostaglandins has an effect on hypothalamus, and with the increase of prostaglandins, there is change in thermoregulatory center at hypothalamus, which causes the increase in temperature of body. So if fever and delirium is present, you can say the differential diagnosis as encephalitis, typhoid, meningitis, hepatic encephalopathy. And if fever and throat membrane is present, the differential diagnosis can be diphtheria, infectious mononucleus agranulocytosis. So fever, paroxysm of unknown origin is defined as persistence of temperature more than 101.2 degree, more than 3 weeks duration, and failure to reach diagnosis even after 1 week of evaluation, which is seen in case of abscess, UTI, endocarditis, SIV, parasitic infection, malignancy, and hyperthyroidism. Thank you.